everyone, and welcome to Prevention Works. I'm Emily Hatchwell, your co-host.
And I'm Michelle Simons, Prevention Coordinator for the City of Lynn.
And today we are gonna have a presentation for you guys on the basics of addiction. So we like to call the presentation Addictions 101.
And what you'll see today is mainly if we do get asked to do a presentation at any local agency or facility, this is basically what you see, or we can cater it to whatever is needed.
Yeah, so if you would like us to come and give this presentation to a group of people, feel free to contact us. So let's get started. So like I said earlier, we're going to be doing a presentation on Addiction 101. And some of our main focus for this presentation that we're going to talk about is the basics of addiction. We're going to focus a lot on opiates just because that's the field that we work in predominantly. And then we're also going to talk about how to respond to somebody who might be using substances and how to work with them and meet them where they're at. So the first thing that we would like to talk about is we just want to talk a little bit and remind you about our Facebook and what we do. So like we said, we have the presentations available for you guys and they're free, so we'll come and give them to you. And so you can follow us on Facebook or Instagram at Prevention Works with an E, just like our show. And then we also have our website that we launched about 2.5 months ago, preventionworks.com. So feel free to like us on Facebook or follow us and yeah, give us a shout.
Sounds good. Yeah, and the main reason some of the depth about this Addiction 101 is a lot of times even people that do addictions counseling get a little stuck when somebody is actively using and they're not really sure, you're sitting there across from a person or even a parent or something and kind of wondering like, what do I do if I'm sitting across from somebody and I think they might be under the influence? So we're going to give you guys some tips and some ways to kind of bring that topic up and, try and have the least resistance as possible with the person that you might be dealing with.
Yeah, so for our presentation, we are going to start more general, then we're going to get specific to opiates, and then we're going to go general again. So Michelle is actually just going to give you the broad definition of what addiction is, and then we're going to start moving into a little bit more about opiates.
So the website SAMHSA, the Substance Abuse and Mental Health Association, they define addiction as a chronic relapsing brain disease with use despite negative consequences. I really find that definition difficult because it kind of almost minimizes the concept of sustained recovery. And people think, oh my God, does that mean people will never get and remain in recovery? Which is not the case. It's very, there's many, many thousands, millions of people out there with sustained recovery. So, but the disease of addiction is use despite the negative consequences. So the concept is usually people don't understand how somebody can continue to use even though they may have CORD in their life or DCF or, families, marriages breaking up and things like that. And people don't understand why people can continue to use after dealing with things like that. So, but that shows that it is a brain disease and it's not a moral condition or something like that.
And one of the big parts of addiction is actually building a tolerance to a substance. So this means that you need more of the substance to get the same effects. So kind of the science behind this and what the brain actually does is that when you take a substance, there's a huge boost in dopamine levels. And your body has dopamine naturally. So we get a natural boost of dopamine when we eat food, exercise. But when you take a substance, it's an unusually high boost of dopamine. So the brain can't handle those high boosts. So what it does is it decreases the amount of dopamine receptors and dopamine in the brain. So that way it's compensating for all the dopamine that you're getting from the substance. So this means that every time you take a substance, it's decreasing its natural levels a little bit more each time. So you need more of the substance to compensate that.
Right. So we can start with our slides. So the opioid epidemic, this all kind of kicked off in the late 90s. Doctors began prescribing these drugs at enormous rates. They aggressively marketed the drug that you may have heard of, OxyContin. They marketed it as non-addictive. It was basically, if you know what a Percocet is, it's a painkiller. It was basically about 10 Percocets were all wrapped in one pill and on a time release. So they did put a time release around the pill, but it got, people understood that they could crush it, break it down, things like that. And that's where people started misusing this drug. Once the pharmaceutical companies came under fire because so many Americans were prescribed this OxyContin, and part of the reason behind the pharmaceutical companies prescribing them were they said more Americans are in pain and they shouldn't be in pain. And prior to the late 90s when this epidemic sort of began, people were only prescribed OxyContin if they had like late stages of HIV or AIDS, late stages of cancer and chronic illnesses. So then when they started prescribing for arthritis or for back pain and things like that, and this is a really powerful drug, at some point the government started cracking down on the amounts of prescriptions that were prescribed to people, and people were cut off from their prescriptions. And Emily mentioned something, you talked about tolerance, and we'll also talk about dependence a little. People were physically dependent on these opiates. So the difference between somebody with the disease of addiction and not is Emily and I could both be prescribed for, let's say, a few weeks on OxyContin. And when we're both cut off our prescription, she may go through some withdrawals and some, feeling not so great, and we'll get into that a little later. And somebody with the disease of addiction, if that were to be me, I'd be going through the same withdrawals, but the brain, this compulsive thing happens in the brain where you have to have that drug. You have to have it at any cost, no matter what. And so I would probably go out on the street and seek it out. 80% of people that are addicted to heroin today started on a prescription pain medication. So lots of people that were cut off from their prescriptions in the early 2000s, late 90s, early 2000s, and so on, and it continues to happen, tend to end up going for street drugs. They'll first go for the prescription street drug. That becomes very expensive. OxyContins were going for about $80 a pill. And a bag of heroin is $10 a pill. So what do you think is going to happen if somebody's sick and they can't afford to purchase the pharmaceutical version? So most people ended up going to heroin. So that's kind of a little bit of the history of the opioid epidemic that we're seeing today.
Yeah, just a little bit of background as we get into it a little bit more. And so the next thing we're going to kind of talk about are opiates in general, just to give you a little overview of what opiates are. So on our next slide, you can see that opiates are a moderate pain, they treat moderate to severe pain, and they're actually a naturally occurring substance, and they're found in the opium poppy plant. So some opiates are natural, and some of them are synthetic. So ones that you've heard of recently, like fentanyl, that's actually a synthetic opiate, so it's basically man-made, but there are other ones like morphine that are natural. So that also, depending on if it's synthetic or man-made, changes the amount of time that it takes to make it as well. So the difference between an opiate and an over-the-counter medication is that an opiate blocks the pain receptor, and so basically the pain signal doesn't get to your brain, whereas an over-the-counter medication reduces the inflammation at the site. And just some examples of this, because I know I said fentanyl is an example, heroin, OxyContin, Percocet, and morphine. So all of those things are in the same class of substances. So it's just something to keep in mind that the stuff that you're getting prescribed legally is actually in the same class as the illegal substances like heroin.
Right. And the fentanyl that we're seeing in the street is not the pharmaceutical version of fentanyl. What we're seeing is it's being made in China and being shipped over here, and it's not a pharmaceutical version. It's a street drug.
Yeah. We just like to point out a little bit about opiates in dental surgery, just because we work with parents a lot. So as you can see on this graph, 30%, and it's that orange line that you can see on the second set of bar graphs. So 30% of opiates are prescribed by dentists for patients between the ages of 10 and 19. And the next slide, you can see we're going to talk a little bit, go into signs of an opiate overdose. So just so you have an idea. And then we're going to talk a little bit about Narcan and what that is. So just the signs of an opiate overdose, you have pinned pupils, you're not arousable. So often people give a sternum rub, which is when you rub the sternum with your knuckles. And if that doesn't wake somebody up, that's usually a very good sign that they're in an overdose. And they're usually not speaking. Their breathing is slow or stopped. So that's usually less than 8 breaths per minute. And this is because opiates affect the brainstem, which controls all of your basic functions. So it controls your breathing, your heart rate, your blood pressure, all those unconscious functions that you aren't thinking about. Another symptom is actually like a gargling or snoring noise. And this is because your airway passage, it can get blocked. You might be choking on vomit at that point. So if you do hear somebody snoring and they've taken a substance, you want to go over and do a sternum rub to see if they are overdosing or if they're actually just sleeping, because you might not be able to tell the difference. And if somebody is having an overdose, you would administer Narcan. So there are some Narcan trainings online that you can do for free. And if you keep an eye out, sometimes they have them around Lynn, Peabody, and Salem. So Narcan is an opioid antagonist. And I have trouble with that word for some reason. And what it does is it basically blocks the receptors so that the opiates don't have an effect. And that can reverse an overdose pretty quickly. Yeah. But for substances like fentanyl, you actually need more of Narcan to take somebody out of it because fentanyl is so strong. It's usually about 50 times stronger than heroin and 100 times stronger than morphine. So oftentimes you need multiple doses, and I've heard up to 8, 9, 10 doses at a time being administered. So this is the Narcan. So you can see that it comes in that nasal spray. And you can actually get that at any local pharmacy. It's a standing order, so anybody can get them. And then just the next slide, we like to give people the numbers for Lynn, just because you hear so much about the big numbers, and we will give you the big numbers, like the nationwide numbers, but I think it's important to know what's happening in your own backyard, basically. So 2018 was actually the first decrease that we saw in 10 years. And I know it looks like a small one. 2018 is the green line on the bar graph. It looks like a small increase, but it is the first one that we've had in a long time. And looking at the overdoses this year, it is possible that we might have another decrease, but that's something we can never predict because we don't know what's going to happen month to month. Some months we have a huge spike, some months are low. It just kind of depends on what's happening. And then as you can see, the fatal numbers as well. There was a bit of decrease in 2018 in that bar graph. And the total for the first 6 months of 2019 has come out to 22. So if we keep on that path for the next half, we could have another decrease. But like I said, it all kind of depends.
And some of the reasons for that we've kind of thought about through our data and through what's going on are the availability of Narcan might be one of those, and the other one is the recovery coaches. We have recovery coaching going into the emergency departments now. It's after an overdose to connect with people and try and make a connection and open a door to treatment that way. Mm-hmm. So that's a couple of possibilities of why. Yeah. But like we said, we can never really know what's actually happening. So the next slide that I want to show you are the national numbers. So it is those really big kind of abstract numbers. So you can see it's about 42,000 for the whole year, but I like this graph because it really shows you which substances are causing the most overdoses. So the top line, the orange one, is synthetic opioids, and that's the one that's fentanyl. So fentanyl is causing the most overdoses, but I think it's important to note that the second line is actually prescription opiates. It's not heroin. So that's the stuff that you're getting prescribed by your doctor. People can buy them on the street, but I think it's just important to remember that it is the second one on the list because they are all in the same family.
And this slide just shows you a little bit more about what fentanyl is. Like I said before, it's 100 times stronger than morphine and 50 times stronger than heroin. And oftentimes people don't know that they're taking fentanyl because people just put it in with whatever substance that they're buying. And that's part of the reason that there have been so many overdoses, is because fentanyl is so strong and they're taking so much of it that they're not even sure that they're taking, so they don't even know that they are.
So our next slide coming up is how do drugs affect the brain?
So these are just some areas of the brain that the drugs mainly affect. So one thing that you need to remember though is that drugs affect the whole body. They're going to affect all of your system, your brain, your organs, everything. But these are just some of the main areas that we think are really important to mention because it's things like the prefrontal cortex. So that's part of the cerebral cortex, so that's the third one down. And the prefrontal cortex is part of decision making. And this part is important, especially in use as a teenager, because the brain isn't fully developed, and the primary area that isn't fully developed is the prefrontal cortex. So they already have an underdeveloped prefrontal cortex, and then they're taking a substance that affects the prefrontal cortex. So that's two things playing together, and that can often have effects on their development in the future.
Right.
Another area we like to mention is the limbic system, and the limbic system has to do with your emotional responses. And then also, like I mentioned earlier, the brainstem, and that's the part of your body that keeps you alive. So it's those basic functions like breathing, blood pressure, and heart rate. So on the next slide, we're going to talk a little bit about risk and protective factors, and I'm going to pass it off to Michelle because I've been talking way too much.
So risk and protective factors are some things we talk about that may put a kid at risk for developing a substance use disorder. Mm-hmm. And protective factors are just that, something that would protect a child from developing a substance use disorder. None of them are guaranteed, and that's the main thing. So genetics is one of them, having a family member that struggles with alcoholism or addiction, substance use disorder. Poor grades in school, mental health issues that are sort of, maybe untreated or not, recognized, early aggression, socioeconomic status, things like that. And also like another risk factor is like, the general attitude towards drugs that either the neighborhood, environment has, family members have, things like that. Mm-hmm. And availability, of course. Is it available in the neighborhood? And, most schools nowadays, whether you're in the urban areas or the suburbs, drugs are readily available, and especially the prescription drugs. Mm-hmm. And that's why we always campaign to lock your medicine cabinet. If you do have prescription medications that are commonly misused, which we've discussed in some of our other shows, count them. If somebody's on a short-term prescription for an opioid, then count the pills or make sure they're in a safe place. And now turning to protective factors are things like, parents that are available. And even if a kid, one that always sticks out is even if a kid doesn't have parents that are available or there because they're both working, or maybe they're in a single parent home where the single parent has to work, having one trusting adult in their life can make a huge difference. That's something that really stands out, just having that one person. Other protective factors are doing well in school. Parents have disapproval of substances, so some like guidelines and rules in the family. Mm-hmm. Understanding the risks and dangers of prescription drugs. Mostly people think, oh, it's a prescription, the doctor gave it to me, it's not dangerous, right? Yeah. A lot of times, like these opioids, heroin and an Oxycontin, their chemical composition is not that much different. Mm-hmm. Same with things like stimulants, like Ritalin or Adderall and methamphetamine, right? Mm-hmm. They are, the Adderall is methamphetamine, right? It's just not crystal methamphetamine. So they're not that far off from each other just because one's a street drug and one's a prescription. Yeah. So moving on to our next slide.
We're going to talk a little bit about addiction versus dependence. And Michelle touched on this a little bit earlier. So we just like to stress that dependence does not equal addiction. So somebody can actually become dependent on a substance within a few days. So if you're prescribed an opiate, you could become dependent on it by the end of the week if you have a week-long prescription, or even a few days. And this basically just means you're going to have a few of the withdrawal symptoms, which we will talk about later. Actually, I think we missed that slide. So it's things like restlessness, trouble sleeping, nausea,
Flu-like symptoms.
yeah, flu-like symptoms,
Sweating.
restless leg, goosebumps, stuff like that.
Yep.
So you basically feel like you have the flu. And when somebody is coming off a substance who's been using it for a long time, they have those symptoms times like 100. And that's kind of the difference between when you become addicted to something, the withdrawal symptoms are much worse because you've been taking the substance longer. So usually when you're addicted, you have a dependence to that substance. But like I said before, it's not just because you're dependent does not mean that you're addicted. So it can get a little confusing and a little muddy. Right. And hopefully I clarified it for you. So our next slide.
Yep, so some signs of substance use disorder. Some of the obvious here, you can see deterioration in hygiene, secretive phone calls, mood swings, personality changes. When we say, you'll hear things like nodding out, which looks like falling asleep, but it's a little different. Angry outbursts, disrupted sleeping patterns. Obviously, if you find your valuables missing, there's probably something going on, and loss of interest in, normal activities that your child or friend, family member may normally be engaged in. So next slide. So what to do if you're in front of somebody and, whether you're a teacher, a parent, you work in this field as a therapist, I think it's really important to know sort of what to say. And if you're sitting in front of somebody, you don't want to, be accusatory because things are not probably going to go well. So some of the things, knowing the right questions, like if I looked at Emily and I thought one day she was high, I would look at her and say, like, is everything okay? What's going on? Like, are you on medication? Have you taken more than, did you take too many accidentally or something like that? And you keep the conversation like that. So speaking up is really important, and just asking the person, like, what's going on? You don't seem like yourself today. The next piece of that would be having resources readily available. So if I'm asking Emily if something's going on and she's telling me yes, like I've been struggling or whatever, if this happens to come out, knowing where to send her or give her some help. So how can I help you? And having a general idea of what the resources are. So there's lots of levels of care, and we can get into that in another episode, but there's many levels of care when it comes to substance use treatment, and we're talking about things like, from outpatient counseling all the way to detox, right? So those are like kind of the two extremes, or residential programs and things. So having an idea of what the person may need and being able to offer that, and knowing what our local resources are.
Yeah, and a lot of that stuff is we actually have on our Facebook and our website.
Yes.
So if you do need any of those resources, you can look us up, and feel free to ask us too, because we can point you in the right direction of where to find those resources, because they might like get buried on the website and stuff.
Right.
And we'll also start working on a post about levels of care.
Yep. So our next slide, just some response tips. We'll go through these quickly because I know we're on our last couple of minutes here. But don't force or threaten, and don't, our agenda may be very different from the person we're dealing with agenda. So don't expect any immediate results, or assume that, just because they've admitted that something's going on, that they're going to, go to detox and get the help and, get clean right away. That's not how it necessarily goes. It's usually a process. And the main thing is, as a supportive person to somebody that might be struggling with addiction, is be there on the sidelines as a support. And you can let them know, like, I'm here for you when, if you want to get help, if you want to do this, I'm here for you 100%. Otherwise, there's not a whole lot we can do except just be available and have resources ready when the person's ready. And that can be a really small window. So some quick tips here that Emily's going to give you.
So this is just the last little bit that we're gonna leave you off with, and these are tips specifically for opiates. So we like to just make sure that people know that they can advocate for themselves. So you can ask and see if you can take Tylenol, extra strength Tylenol, and you can also take a lower amount than you're actually given by the doctor. So you don't have to finish your prescription. Right. If you feel better after 2 days and you think you can take Tylenol, you don't have to finish it. It's not like an antibiotic that right. you have to do the whole week. And if you don't finish it, it's important to know that you can dispose of the substance down at the police station. They have a drop box. That way it's not in the house so people can get into. Right. Another important thing that you want to do is lock up your medication, especially if you have teenagers around. But also it's important if you have pets, because pets can get into it, and if you're living with anybody elderly who might get confused on what medication they're taking. And also to go along with that, just keeping track of how much medication you have left. Mm-hmm. And if there's any way that you can't get to a drop box location, you can actually grind up the medication, put it in with coffee grounds or kitty litter, which are two things that people will probably never eat. We hope we'll never eat. Put it in a plastic container and then throw that out. You don't want to flush them, because when you flush them, it actually ends up in our water supply, and then we're all basically drinking opiates if you flush them. So please don't do that. And that's just going to be the end of our episode. So just a nice quick episode for you, you know. So thank you for coming and listening to us today.
Yep, and we'll flash some local resources on the screen as we close up here. And hopefully you can take those down, or if you're watching this online, you can pause it. We have some national resources up here, and the second page will be our
local resources, and we'll put these up on our website as well.
Yes. And we want to thank Pedro Diaz for wonderful filming.
For all of his help filming.
All of his help. Little shout out.